And my understanding is a lot of the peak season of time of life for people coming in with panic disorder or young people 17 to 23. Tell me if that's correct, and if so, why are they the candidates? What is there about that particular age group?
But that's the age group where they would have their first panic attack very often. It can come later, but this is the majority of folks. And, you know, we don't exactly know why. My theory is, and others would probably say it too, is it's a time of uncertainty. All people with all anxiety don't tolerate uncertainty very well. So when I'm in high school, I kind of know what the rules are, and I'm breaking them or I'm not. Once I get to college, I can stay up all night if I want. I can drink as much alcohol if I want. I can skip classes, and the decision making is no longer clear for me. And when that starts happening, it kind of puts a crack in the defensive system. So if I'm panic disorder waiting to happen, which is more like what I would think it would be, there's a genetic component in a lot of the anxiety disorders. Then if I get that critical mass built, then it starts to show up at those times. The other thing we look at is 6 to 8 months of stress just before the first panic attack. So that's the other thing that brings them over the crest. What we look at for the stress tends to be the theme of loss. So getting divorced or getting pregnant, having a best friend move away, a family member being severely ill, those types of things bring up a threat for some reason. Some of these people have early childhood loss. So, but we don't have to go through a lot of that developmental stuff. The other thing I would just say, although we don't need the developmental stuff for the treatment as much, sometimes we want to go back in the past a little bit to make some sense of why this is happening to me. Because, one, I have these intense feelings, it's an onrush of physical sensations, thoughts of impending doom, and then there's a mystery. I've been to 6 doctors. No, everyone says it's anxiety. I think I'm having a heart attack. I go to the emergency room 3 times. They dismiss me. What's wrong with me? So if we can put it a little bit in context, that seems to be helpful to people just to give them some reassurance. Then we can get going.